Hi, and thank you for participating in EUTF's Open Enrollment webinar. My name is Sammy, and I will provide information on EUTF's prescription drug plan for EUTF and HST-ABB active employees. I will provide an overview of the prescription drug benefits, your pharmacy network, plan changes that take effect on 7/1/2025, and resources on caremark.com to help you manage your prescriptions easily. In 2025, there are no changes to your copayments or calendar year maximum out-of-pocket. CVS Caremark and EUTF encourage you to use generic or preferred brand medications when possible, as you are charged a lower copayment, and we ask that you fill your prescriptions in a 90-day supply at a Retail 90 network pharmacy or through CVS Caremark's mail pharmacy located on Oahu. Doing so will save you money by getting a 3-month supply for 2 copayments. Maintenance medications are prescriptions taken for an extended period of time to treat chronic conditions such as high blood pressure, diabetes, heart disease, or high cholesterol. New maintenance medications are limited to 1 initial fill plus 2 refills before a 90-day fill is required. Specialty medications are high-cost treatments used to treat complex health conditions and are usually filled in 30-day supply only. Your copayment depends on whether it is a generic, preferred, or non-preferred brand drug, and copayments are capped per fill. Specialty drugs also have an annual cap of $2,500 per calendar year, which is applied to the overall calendar year MOOP as well. For HSTA-VB members, there are also no changes to the copayments and calendar year maximum out-of-pocket. You will continue to have low, fixed copayments as listed on this slide. Again, we encourage you to fill generic prescriptions and to fill your maintenance prescriptions in a 90-day supply at a participating pharmacy. The copayments are the same for non-specialty and specialty medications, but specialty medications are limited to a 30-day supply. You can fill your prescriptions at any network pharmacy. Nationwide, there are over 68,000 pharmacies, and here in Hawaii, there are over 200 pharmacies statewide. Our network consists of many pharmacies, and you are not limited to using just Long's or CVS pharmacies. Some other pharmacies you can use are Walgreens, Costco, Time supermarkets, as well as some smaller locally owned pharmacies like Pharmacare, KTA Pharmacies on the Big Island, Kalaheo on Kauai, and Safeway, Molokai Drugs, and Rainbow Pharmacy in Maui County. As mentioned earlier, all EUTF active members receive a lower copayment by filling maintenance prescriptions in a 90-day supply at a Retail 90 pharmacy or at CVS Caremark mail pharmacy located on Oahu. More than 90% of Hawaii retail pharmacies are designated as Retail 90 pharmacies. Filling your prescriptions at the mail order pharmacy gives you the added convenience of having your prescriptions sent directly to an address of your choice within 2 to 3 days with no shipping fees. This does not apply to home delivery fees from retail pharmacies. There are 4 plan changes that will take effect 7/1/2025. The first change is a formulary change to the Basic Control Formulary. A formulary is a list of drugs that are covered by the plan. The Basic Control Formulary targets non-preferred products in 10 drug classes, and a member will need to use the preferred products first before a non-preferred medication is covered. The second change is a program called Hyperinflation Management Program that targets highly cost-inflated drugs that have a clinical alternative that is medically effective but at a lower cost. The hyperinflated drugs will be excluded from the plan. For both of these plan changes, please know that medical exceptions are available if your physician states you are unable to take the preferred products due to medical reasons. The third change is a revision to the prior authorization to obtain coverage for GLP-1s like Ozempic or Mounjaro for the treatment of diabetes. You will need to have a prior history of non-GLP-1 diabetic medication in the past 24 months or a diagnosis of diabetes from your doctor. The last change is adding 100% coverage for medications like Apretude, Descovy, and other drugs for HIV PrEP when prescribed for prevention. This is the only change that applies to both EUTF and HST-ABB plans. Members impacted by the Basic Control Formulary and Hyperinflation Management changes will receive a letter in May 2025. As a CVS Caremark member, you have access to all your prescription information at caremark.com or through our mobile app, which is the blue app on the bottom left corner of this slide. There are many convenient options to manage your prescriptions, and you will have a personalized dashboard where you can review your plan details, check the cost of your medications, search for pharmacies in your network, and much more. To learn about your plan benefits, You can view your EUTF plan summary under the Plan and Benefits menu and select Plan Summary from the drop-down menu. There are also useful tracking tools to track the copayments that are applied to your calendar year out-of-pocket maximums. One of the more popular features of Caremark.com is the Check Drug Cost tool. The Check Drug Cost feature will let you know if your prescription is covered and how much you can expect to pay based upon the EUTF plan you are enrolled on. You can get to this tool from the dashboard. Once you're in the tool, start typing the name of your medication and select the medication and strength you'd like to view. When you make your selection, several options will appear that will display the cost of medication, and if available, you will also get up to 5 lower cost options that can help save you money. You can share this information with your doctor to discuss if any of these lower cost options can work for you. Lastly, I want to show you the pharmacy locator. This is a handy tool if you are on the go and need to find a network pharmacy to fill your prescriptions. The pharmacy locator can also be found on your dashboard under Member Resources. In the search bar, you can enter your city and state or your zip code and select the search distance from the center of the zip code. If a pharmacy is within the network, it will appear in the results using the distance marker you selected. If you have a mobile device, you can also use the pharmacy locator through the blue Caremark app using the locator technology through your device. These are just some of the features available on Caremark.com or through the mobile app. If you'd like to learn more about these tools, you can find more information on the digital flyer posted at EUTF's portal at caremark.com/EUTF. But the best way to learn about these tools is to simply log on and to surf the site. I trust that this summary of information has been helpful in learning about your benefits, where to fill your prescriptions, and about your plan changes. If you need additional information, please call customer care at 1-855-801-8263. We are open 24 hours a day, 7 days a week, or log in to caremark.com for additional information. Thank you for taking the time to learn about your prescription drug benefits. Mahalo!